I'm Hanne from Germany and I'm a young carer.
My name is Kathleen and I'm a carer.
I'm Hang-Wen and I'm a carer.
Ilham and I'm a carer.
I'm Alan and I'm a carer.
But what do we mean by a carer? And why do we want to know if you are a carer? We know how difficult it can be for you to care for someone else and still care for yourself. It raises the question, who can support you when you are caring for someone? But first things first, what is a carer? In the United Kingdom, a carer is seen as a person who looks after and cares for someone who, because of being ill, possibly not well for a long time, and is not able to care for themselves without support. This could be down to a mental health condition, having an addiction to drugs or alcohol, having a disability, or even just simply becoming old and frail. So once you've realised or become a carer, what do you do next? I'm joined by Alan Mersell-Sanker, who has experience of this firsthand. Alan, I understand that you and your mother were carers for your father for several years following the deterioration of your father's medical condition. You are of dual heritage. When we spoke earlier, you mentioned that whilst your ethnicity wasn't a barrier to accessing carer support, you felt that in some cases it could be an issue. For example, first or second generation black and minority ethnic community members, commonly known as BME, language and cultural differences could be the reason. Could you expand on that?
For many members of black and minority ethnic communities, caring for family members and friends who are sick, have terminal illnesses, or who are disabled is the normal and natural thing to do. This leads to unawareness of the types of valuable support that exist and can be accessed through being recognised as a carer by your GP and local social services. Also, there can be confusion about this term of carer. This can suggest only people who are carers by profession, such as in private care homes, rather than family members or friends who are out of a traditional sense of loving respect or simple humane feelings instinctively provide caring practical support to loved ones. Further, it is quite common for there to be fears about becoming registered as a person engaged in caring activity for family members or other friends and loved ones, involving the intrusion of strangers into their home settings. This is an understandable error, but not knowing that support for caring activities is by consent of the carer and cared for stands in the way of really valuable, practical, non-intrusive support being provided to carers and cared for in real need.
You and your mother have been engaged in major caring activities for your father for at least 3 years before gaining NHS and social services support. Was there any reason for this?
Well, this was my and my mother's experience in caring for my father. Sooner or later, almost everyone comes to provide support for loved ones. When you become engaged in this activity, it understandably becomes a major part of your day-to-day life, and as a result, finding out about support available through the NHS and social services isn't always a priority.
For example, there is lots of practical support, such as equipment installed in the home, help with getting to the doctor or the local hospital for tests, for treatments or physiotherapy, and there could be carer support allowance.
Commonly, these are not known about and far less about the processes of applying for them. So, in our own case, we only learned about the support that was available to us in looking after my father through a friend who had become a carer too. This lady recognised all of the signs of the great stresses and pressures involved with caring. It was therefore through a friend rather than through our GP or local services that we learned about what support we were entitled to. This was about 6 years ago, and since then a lot has changed. GPs and social services have realised and seek to remedy gaps in providing awareness about what valuable support exists for those engaged in caring activities.
I'm now joined by Ginny from Dorset Healthcare, who will help to discuss some of the various services available. Ginny, where is a good place to start when you're looking to access services for carers?
First of all, anyone can access the NHS Carers Direct webpage about carers. This can be very useful. Apart from information about our rights as a carer, how to make sure that you receive the right kind of help and support, the information is also available in over 170 languages. The NHS and social services can provide you with people who speak in your own language, so you can also be assessed by someone in the social services who can give you advice, information and tell you about things that can help you.
So it's as simple as that. 1. Recognise that you're a carer. 2. Tell someone, either your doctor or someone else who works with carers, that you are one. And 3. Make sure you know about your rights, mainly the help and benefits you can get. So if we start with the GP or doctor, what are the advantages of telling them that you are a carer?
They can offer special support such as free flu injections to keep you, the carer, as healthy as possible in the winter. Often they will help you access more convenient appointment times or get help from a carer support worker. If you are unwell, the doctor can talk to you about how the person you care for will be looked after while you get better yourself.
I never considered that. Is there anywhere else you can get advice from, like social services?
Yes, you see, any carer, whether you are old, young, born in this country or not, from whatever background, once you're assessed for the help you need as a carer, might be able to get help with washing and dressing the patient, meals on wheels, aids and adaptations or respite care.
Sounds interesting. Meals on wheels? Respite? What's that then?
Social services can help to provide a way of getting meals to those who need it, but also offer a way for carers to have a break and rest from the job that they do for their cared ones. You can also get someone to bring food in to feed the person you care for.
Sounds simple. Do people have to pay for this help?
The system is there to help look after people. The patient may have to pay something towards the cost of the help that they get, depending upon how much money the patient has. They may have to pay for help like washing, dressing, meals, respite and daycare, but many people don't have to pay. There is also help for carers, and this is usually free of charge. This might be carers groups, therapy vouchers, advice and information. The main thing is to recognise that what you do for a family member, friend or relative is part of the caring service, and therefore register so that you can benefit from the help and advice that is available. It is really important to let the doctor know if a young person is involved in caring.
What if the system doesn't have the adequate services to take into account the multicultural and religious needs of me and the person I care for?
This can be done through the help of a carer support work and the NHS Direct Carers webpage. This will help to develop confidence to talk about cultural needs to the people who can help.
You mentioned earlier that anyone can be a carer. Can you tell me anything about young carers?
A young carer is someone aged 18 or under who helps to look after a relative, so they are carers too. For most young people, it is important to know that there are various support systems available to help them cope better with balancing caring, school, friends and other activities. If caring is affecting schoolwork, the young carers worker will be able to talk to the teachers to see how the young carer can be helped to manage. There are different young carer groups available for moral support, and the Young Carers Charter is very good at setting out the rights of a young carer. It is really important to tell the doctor if a young person is involved in caring, and if it is causing them any distress, to have a chat with the Children and Families Department of Social Services.
So why do you think that some communities do not register as carers or even identify themselves as a carer?
For some people who came from abroad, the system for caring for relatives is more mixed into everyday activities, so the idea of being a carer is not familiar enough yet. Some may feel that the service is for British people, some do not find the service is culturally sensitive to their needs, while some may have had a bad experience as a carer. There are plenty of organisations and groups that support carers. These groups can be around medical matters such as cancer and mental health, or around religious or support groups from your country. I am therefore encouraging people to come forward and make sure that you get the right support and help in caring for you and your loved ones.
Thank you for your time, Ginny. This DVD will be useful in raising awareness about the carer system to encourage more people to get the right information, advice and guidance.